Welcome. Before we begin, I just want to say a few words about the organization 3PDK. This webinar is hosted by 3PDK, which is a nonprofit organization based in Denmark. Our purpose is to spread the understanding of the three principles, and it's spreading all over the world. Um, this is an understanding that's a spiritual understanding, and it has helped people overcome stress, anxiety, addiction, depression, and help people find back to clarity, peace, and mental health again and again. You can learn more about 3PDK on our website, 3p.dk, and in the Facebook group 3PDK, De Tre Principper, Denmark. And today we're welcoming Jean Catherine Gray and Anita McGinty, who are both with Innate Health Research, and they do research on the effects of understanding the three principles in different settings. And last year they did a big survey that a lot of the Danish community participated in and helped make possible. So we are very, very happy and thank you so much for being here, Jean Catherine and Anita. We're so grateful that you want to spend your time here and let us in on the results from the big survey. So I'm going to hand it over to you and you can introduce yourselves how you would like to and go ahead with your presentation. Thank you for being here.
Thank you. Jean, do you want me to go or you go?
Well, they do want us to introduce ourselves. So, Anita and I co-founded and co-lead Innate Health Research. So if you're not familiar with our organization, we're really interested in studying community mental health programming that's making a difference. And especially because the global mental health issues have continued to increase across countries and spaces. And we've been really fortunate that our program partners have been amazing three principles practitioners. And we're so pleased with the relationships we've built and the projects we've been involved in. And there's a lot coming, which we'll let you know a little bit about at the end. So a little teaser for the end. Um, and then Anita and I really split roles. So she does a lot of the roles that have to do. I mean, we meet on everything, so don't get us wrong. But Anita thinks a lot more about strategy and about big picture and about, manages the board and the budget. And even though we talk about all those things and we influence all those things, she's really has a mind for that. And I do a lot of the sort of collaboration on projects and lead research. And so again, we all meet on that. It's definitely a team effort. It's definitely collaborative. And it makes, in some ways, our research unique. Not only are we researching a very unique intervention, but we also, as a team, run research in a different way that really involves collaboration and co-partnering and your feedback, right? Your interests, your feedback, your questions. So just a little overview on that. And Anita, do you want to jump in and add some things?
Yeah, well, I'll just introduce myself. So, I think one of the things Jean and I always like to share is that innate health research really came out of, it began with Jean being one of my first people to introduce me to the principles. She ran a large organization or an organization that did a lot of training and mentorship and coaching and independently, I had a research career in academia related to children birth to 8 and and got into a lot of projects that worked at the state level and national level and saw how data and research really shapes the things people think about or find credible, where money gets put, where people pay attention. And so and that was totally separate from my learning about the principles. And then a number of years ago, Jean also was pursuing a PhD, much more related to the topics, of spirit, of psychology that touches aspects of it of three principles programming, and we started talking, and then had this idea of, well, a lot of her work was just so robust in these different program partners. How about an organization and work together? I was not planning on joining. I was just planning on advising her on how to create an organization. And then, we ended up sort of lots of unplanned things that led us to be able to be here together and continue to be here together. So we are unique. We bring deep experience and research from different lenses, and we have Adrian, who stays out of the sort of advocacy role and really makes sure the science is independent. But we as an organization came from experiences with three principles, and and maybe I'll just use that to start launching. I could share my part, I can start to present what we're going to show, but I think you'll see that we are seeking to promote three principles as related to some bigger ideas related to the mental health crisis. And we just think it's a really powerful approach that needs attention. So we sort of blend
And
our work.
while Anita pulls that out, I mean, most people have probably heard my story, but my background was actually as a mental health patient, right? So for me, it was a three principles changed the course of my trajectory. And I think allowed me to pursue a PhD, allowed me, my understanding changed how loud or quiet my mind was. And so it really motivates me, this potential that people could find this peace within that allows them to navigate really horrific circumstances. And so that's one of the pieces that's very important to us, is working with lived experience partners. And so hopefully that comes through, even though some of this is going to be a little bit bigger data. I hope that comes through during the presentation.
Can you see?
Yes, we see it. Building evidence for grassroots mental health.
Okay. And I have the date wrong. Sorry. This is so all right, let me get my navigation. Never know. Okay, here we go. Okay. Yeah, so I think we come to this really from two sides. One is, wow, the experience of having three principles training and is personally powerful. But as researchers, you always want to think, okay, but what's the broader thing beyond my experience? What's the broader thing that we're pointing at? And so I and Jean really, we position the work and the potential of three principles and our work as really related to the mental health crisis that's going on globally. So it's mental health is the leading cause of death worldwide. And despite a lot more talk about mental health, we're not curbing its impact. The youngest generation is the most vulnerable, with almost 25% having an incidence of anxiety, 1 in 5 having a major depressive disorder in the young adult population, 18 to 24. And when that level of mental health challenges that people are trying to figure out how to handle, it's not an individual problem. It's a problem that goes then through our schools, it goes through our families, through our communities, through our systems, and our workforce. And so, we can't have thriving when we have that level of challenge. And we need solutions that then can really work at that systems level. So I think that's a big motivator for us is how do we push really important ideas into that systems level. And when you think about it, there's so much out there that is good and helpful. Three Principles is a good example, but programming that's happening in this corner of this community, in this online program, in this word of mouth program, we call those grassroots solutions, and they're powerful. That's what I experienced, when I got to go to training here in our hometown, Charlottesville. But they don't get raised up as credible or systems level because they don't have evidence. And we're up against the fact that most of the discussion in mental health is about diagnosis. So most of the dollars that are at governments worldwide put to mental health is focused on diagnosis and not on intervention, and almost none of it goes to prevention or community-based solutions. So I think less than 2%. And at the same time, we know so many people do not partake in wanting a diagnosis or even this very medical approach to symptoms-based reduction that kind of overshadows most of our mental health. And there's some suggestion that over half the people who need help just sort of don't partake in the system because the system doesn't speak to them as being useful or helpful. And there's other smaller studies that say, why are we spending this way? Because community-based and prevention-based solutions seem to have the most potential. Like, for every $1 in a community-based mental health program, and, where the focus is on those with lived experience or something to share, wisdom to share, not necessarily a doctor who's going to diagnose and then treat, but a community-based program and a prevention program, sort of one in every $4 or $5 back in community benefit from those kinds of programming, and yet very little attention is going there. And a large part of that is that there is just not research to get public dollars to start to look at that kind of programming. And so these are the gaps that exist in the world related to mental health. And this is the gap in which Innate Health Research, our organization, sits. And we really, our emphasis is on how to be champions of ideas that we think really add to the landscape of mental health options in ways that are really transformative, where we stop talking about diagnosis and symptoms management, but about the idea of transformation and flourishing, thriving, where we talk about the power of those with lived experience to teach others and to share what they know, to bring others along. And we also recognize that the way we build data about that matters. So it's not just that we're going to go out and research it, but how do we research it? And we research in partnership, true deep partnerships with those who are doing the work, as well as creating pathways for lots of small programs to come together and have a voice. So that those two ideas really guide a lot of how we do our work and research.
Yeah, and an example, there are a couple different ways that as researchers we can align ourselves with people's experience, be listening to people who are on the ground, both delivering programming and receiving programming. And one way we've done that is by doing research projects that involve both a pre-post questionnaire, a follow-up, and interviews, right? That's a very qualitative interview method, is very well known for being able to be present with another human being, hear their experience. But another thing that we have done is when we design the research, we will often involve, and pretty much always involve, a program partner of some kind, because they know better about what's happening on the ground, what things people are up against. And so information coming back from our program partners during the research design process has also fed into the surveys that we've created. And that's actually pretty unusual in research. Usually in research, there's not that kind of back and forth going on. And then the last thing I want to say is, I had the opportunity to collaborate with two lived experience partners who had learned Insight to Wellbeing, which is a manualized Three Principles program, and they now deliver Insight to Wellbeing. And so you can find one of those chapters is a chapter in a book. I actually have it right here. Handbook of Lived Experience. So if you want to, you can ask your local library to have this handbook in your library. There's a chapter in there. There's a collaboration co-produced chapter. And then there'll be another one like that coming out in a British handbook by Routledge. So there are things like that going. You can see there's sort of multiple ways in which we're attempting to interface and invite and engage people from different levels and different backgrounds.
Yeah. Yeah. So sort of I guess what I'm thinking about is we are champions of three principles because of our own experience of it, and we see the value of it. But I think it's really important for you all maybe to hear from us or to think about it as an example of addressing the mental health crisis. Three principles is also really important, not just because we experienced it and it's good, but because it stands for these bigger ideas where it addresses mental health from a internal capacity lens. It's offering data and exemplars that can be powerful scientifically if you all come together, if we find ways to bring your data and information together that can demand that the scientific community, takes notice if we pool it the right way and publish it the right way and do it, and that it opens up, beyond even three principles, it opens up the idea that such efforts are important, that we want to talk about people's capacity, that we want to have programming that lives in communities. And so, we're sort of excited on both those levels of what we're trying to do here. And three principles has really grown in its ability to make a mark because there's programs that are manualized, because there's a global population, because there's conversations going on like what's going on in your 3P community in your country, which are quite sophisticated. So it's exciting to us. And so as a result, we work in about 4 different ways. I'm going to touch on a little bit of each of these so you see sort of the project we do want to talk about, which is a survey you were part of and some of the data, but we want to put it in lens of other things happening around research and what we're doing here at Innate Health Research. So we work in 4 key ways, which we have sort of touched on. So we really focus on building partnerships. We put a lot of emphasis on measurement and what we measure, which I'll talk about. We put a lot of emphasis on sharing what we're learning in 2 key ways. One is at the highest level of scientific dissemination. So in, strong journals that have very strong records, rigorous, peer review processes, conferences that have a global academic only audience. These things take a long time. The articles are not particularly friendly to read. They're not useful for spreading knowledge, but they are very useful for building credibility, and they're really important. And they take a lot of time, but we focus on doing, enough of it that it really crosses a threshold of evidence. Simultaneously, we think about how to have the tools of research be usable at the community level, grassroots level, local level, and we'll talk about what we're building with that, as well as how to share it in a non-academic way, like this kind of presentation or others, and other ways, and actually put the data back in the local practitioners or communities' hands about their 3P programming and impacts, which is what we're spending a lot of time right now trying to build, which we'll tell you more about at the end. But those are the 4 ways we work. I can pause. Anything to add, Jean, or questions? Okay. So in terms of our measure, let's talk about that because it's really actually quite important to our work. So we have created, Jean and Adrian really began this, and we've continued as we became Innate Health Research to continue to build on their work. But we are measuring something we call innate health. So there's something really important about, what we're measuring, and Jean can maybe jump in on how it very early days began, but it represents ideas of mind consciousness, and thought in a way that's accessible to anyone, not just people who have learned about the principles. And our intent, yeah, go ahead.
This is an important place to step in because I know there's a lot of confusion from 3P practitioners about why do you ask it this way, or those kinds of things. So one thing I want people to know is that there have been 2 other groups that developed what might be called the 3 principles inventory before. And we did look at those other ones. One was developed by Judith Sedgman and Bill Pettit, and another one was developed by Tom Kelly and Jack Pransky. And we did test those, and we found the problem was we couldn't deliver those measures to people who had never taken a Three Principles program. Now, that's problematic if you want to evidence across the population something that is inherent or already exists. It would be problematic to ask questions about the three principles per se, right? And that's something that really drove me in the beginning. It looked to me like Sydney Banks was pretty clear that innate health exists, that it's been here throughout time, and that it was accessible to anyone, that anybody could understand this and feel differently about the world. And so it seemed to me there should be some way to measure this. Let's call it belief, because we're scientists and we have no other way to talk about it, but to measure this belief or this understanding, without asking about specifically mind, consciousness, and thought. So Adrian and I were very much in agreement about this. A good measure can be measured right across languages, across populations. Can be developed that way. And so we used the missing link, and we derived 21 questions from the missing link that each construct was still part of it. So we're still thinking about mind, consciousness, and thought, but we're thinking about like, what is the everyday language for this experience? And so we did the best we could. And then we tested those. And now this has been refined over many years down to 6 questions and potentially 9 questions if we test some. We're still testing. And so that's where we get into, we've had this opportunity to translate, we've had this opportunity to test across, 7,000 people and 10 languages. That's over this period of time as we develop this way of asking people about their experience of their innate health. And so I'll just add one more thing, which is that, in the scientific language, it is important for us to distinguish between three principles programming and the concept or idea of innate health, and to be able to talk about, because I think three principles programming looks like in the research is very good at increasing innate health, and innate health is very good at making it, change. And so we're going to talk about that more as we go forward.
Yeah, no, that's great. That's great. So our measure, and so to Jean's point, kind of, we did it, which is actually pretty, when you think about, taking a questionnaire and like, today you're tired, and in this population doesn't read as well, and this population is experiencing, lots of other stressors, and this group is, busy and doesn't want to take the, questionnaire, all the things that happen. The fact is we were able to put this measure in relation to other standardized measures that scientists and psychologists recognize that touch aspects of psychology, like well-being or resilience or stress or anxiety or depression, and put it in relation to those things, and consistently it's showing up as relevant and helpful across languages, cultures, and as we said, it's about 7,000 people at this point who've taken not just our measure, but sort of how it works in relation to these other things. And it keeps acting the same. So that's a really exciting thing, because now you have something that the scientific community will think about as a real piece of psychology. We're starting to show that, and we have something that relates to 3P as we talk about the programming. And so then we have it used in a lot of different ways, but there's a certain set of projects that are really pretty sophisticated. And these sophisticated projects used our measure to study the impact of 3P programming in different populations. And the data coming out of these kinds of programs, research programs that we partnered on, are of a publishable level. So all these projects are sort of resulting in scientific dissemination that's ongoing. So right now, the Spark program, which is a adolescent, it can be all kinds of ages of children, but we're studying it in early adolescence, which is about like 11, maybe 10 to 14. Jean has a project that she ran with men in prison, and there's a number of publications and presentations out on that. There's a UK-based project, Slice of Happiness, that's in progress of coming out. There were other studies that were quicker, an addiction center study and a COVID study, and then some more targeted studies. But all of them used our measures and sort of continued to look at the way it works in relation to standardized mental health psychological measures. This is just a snapshot of some of the places you can look to follow our work, and see some of the articles out there. Articles can be hard to find when they're in the scientific literature because they're not always free, but we do try to post about them coming. They're on reports we have are on our website. If you follow us on LinkedIn, you'll get updates about things that are happening. But this is just a couple of the things that are out there, and there's about 3 or 4 in progress that should be submitted. It can take, a year and a half for an article to go from submission to published, but these ones are out there. So, anything more to add, Jean, on this?
Just that we're doing our best to put things up as preprints when we can. So, you can
You
always
can access.
you always access them, hopefully.
Yeah. Okay, so what I want to turn to is I don't know if it's one study, but we call it the Real World Data Project, and it has 2 arms. So one arm is our scientific approach to it, and one arm is our sort of working with localities. But the survey you took is part of this bigger effort. So we have 2 really large samples that we were able. Yeah. Go
We
ahead.
just situate in case somebody
Yeah.
doesn't know what survey. I know most of you probably took the survey,
Yeah.
but if
Yeah.
somebody's watching this, or we
Yeah.
did have the opportunity to take our designed survey with these things that Anita was talking about: well-being, anxiety, depression, right? Validated survey design with our measure, and we were able to ask over essentially what is a 2-month period to people who were attending or connected to either the Three Principles UK conference or to people who work through 3PDC, practitioners who we have relationships with. And so the practitioners really became the people who put out, hey, we have this survey, would you be willing to fill it out? And that's what this data is about.
Well, that's what half these data are about. So on this slide, so what there's 2 samples. So one is we used an independent firm to get a population representative sample of over 1,000. It was 1,062, and we call that normed, and it was done within the English population, adult population. So we have data that essentially represents the English population and how they might perform on our measures, on both innate health and these other psychological measures of mental health. And that creates a baseline for us to compare. It's not perfect, right? That means we're comparing your data to the English population if we compare it. So, there's efforts which we can talk about to wanting to get more norms, but it's a great beginning place. And it's a strong data set because it was completely independently collected and again is representative of the population. The second thing we did is exactly what Jean described, and we have an analytic sample of about 842. We asked it to about 2,000 people. That's not bad. We got research quality data, that we could use and analyze from about 842, and we did that in about a 2-month span. Through partnerships, exactly like Jean described, through you all, through your, connections and through 3PGC, and had a really amazing response from the global 3 Principles community. And Denmark was a really important component of that. Not every country, had the exact same amount of participation, but you all were very organized and were a big part of that data set of that. And so we're using, because the data that were collected in both ways and completely different ways, right? One was really controlled, one was really grassroots. Both had high quality data. We're able to have scientific papers to look at how innate health is working in a 3P, population compared to an English normative population, and we're looking at two different things. One, that innate health is essentially the reason that stressors are essentially how stress affects mental health, that the difference in whether it's positive or negative is really going through innate health. So that's called mediation, that the extent of innate health that you have fully explains the relationship between stress and mental health outcomes. And that's one really strong test of the role of innate health. The second is that it's essentially a buffer. So it doesn't maybe eliminate the relationship. Stress might still cause some anxiety, but it's really buffered or changed by the amount of innate health you have. So we're looking at both kinds of approaches across a number of different papers, and that's the scientific approach. But as we said, that's not the only way we want to look at our shared data, because that becomes a really slow process, and we want to put this information out there for all the people who participated, this is a map of all the kind of areas that were represented in our data set. And so that is what we're calling the real world data project. So that's what we want to share with you today. So this is everyone, not just Denmark, but everyone who participated in that survey approach that Jean described, where we sent it out through the 3P community. So I'm going to go into these results now, and then we'll pull out a little bit of what we could learn from the Denmark specific population. But what we're doing here is thinking about ways that we can share what we're finding in ways that are accessible and hopefully useful to you. So we're also really happy for questions and interactions, or any comments that you have, because it helps us think about what's useful to you. But in terms of who participated, it was not equal by gender. We're looking now at the 3P population in general, and that's maybe expected by who participates in the programming. It was also skewed to be a little bit of an older population, so sort of 40 and up versus younger. And again, that just tells you a little bit about who is maybe participating in the 3P global community, and or who is in the community and willing to do a survey. So it can tell you one of both of those things. And we're comparing that group, that population I just described, to the general English population. So the 3P community is in dark blue, and the general population is in the sort of slashed bars. And what we did is just broke out all the information into essentially sort of 5 groups. So that's what you see across the top, 1 through 5, and I'll tell you more about those groups in a minute. But right now we broke out the information into groups and said, well, how does innate health show up in these different groups? And the groups are sort of ordered by from less or sort of more mental health challenges to less mental health challenges. So 1 is sort of those who have more challenges in their life and some of their internal experience. 5 is those who have less. There's some different variations in the middle. And what we found is that innate health sort of varies in somewhat expected ways across these groups. Not always totally expected, but they vary in somewhat expected ways, and fairly consistently between the 3P community and the general population. So this gets back to what Jean was saying, which is this is something that exists whether you have training or not, and it's something that varies in people, in lots of different ways, and has an influence on them in different ways. That's what this starts to sort of tell that story. It's the beginning of that story. Anything to add, Jean? Okay. So then we started to look closer, and let me talk about these graphs because they're a little bit busy. This is what these 5 groups are sort of about. So, sorry, Everyone's faces is covering up the graphs in my world right now. There we go. Okay. All right. So at the top is the English population, the general population. In the bottom, which is grayed out right now, is the 3P community. So let me just walk you through first the general population. So those 5 groups, we actually were able to label them based on their experience of stress, rumination, their sense of their own innate health, resilience, and their sense of sort of support externally, both their ability to give support in the external world and receive it. That's a psychological factor. Both perceptions are important to sort of this sense of I live in a world of support. On the left-hand side, the very first one is the struggling group. So these are folks who are feeling a lot of stress and rumination and a low sense of their own internal and external kind of support and capacity. Then you go all the way to the right, and the group is thriving. So they have a very low sense of stress and rumination, and a high sense or middle to high sense of their sense of resilience, innate health, and support. And in the middle, you have kind of a variation. So it goes from struggling to stressed, some low stress, but low support also, high stress, but some support in the external world. So, different perceptions of sort of how these folks are experiencing life. And yes, I see a question. Anne?
This just may be me who's not completely understanding the data, but could you just say, for example, what does 1.2, what does that mean?
Yes.
Like
yeah.
in just for maybe also others than me who don't, I'm not used to seeing this exact kind of data.
Yes. Thank you for that question.
Thanks.
So, and the numbers are a little less important, but they're in what we call standard scores. So, something that's a standard deviation, which would be a 1.0, either above or below the middle line, is a really sort of statistically significant difference from the middle. So 0 in this graph is kind of the mean, so it's the middle or the median, and then anything that's above it is sort of really high. So like a 1.0 or above is statistically really large difference, higher than the mean, and 1.0 or below would be much lower than the mean. So that's the way to interpret. So sort of the ups and downs are relative to the mean of that. And in psychology, even a 0.5 or 0.3 starts to be potentially meaningful difference from the mean, even if it's not always statistically significant. And that depends on a lot of things about what you're comparing and thinking about. But so they're in what you call standardized scores. Is that helpful?
Thank you.
Yeah. And so what you see in this, even in the English population, is that essentially innate health is traveling with perceptions of sort of struggling to thriving in expected ways. And so you see, again, low innate health when there's high senses of stress, higher innate health when there's really low senses of stress. And in the middle, you have those who have a low sense of maybe stress and rumination, a slightly higher sense of innate health and resilience, but a low sense of external supports. So that begins to start to point to the buffer idea of innate health, that there's not this external support in the world, but also I'm not feeling as much stress and rumination. That was an interesting finding in the general population. Remember, these are people who've never been trained in 3P or anything. So then we wondered, well, how does it look in the 3P community who has received training? And not everyone has the same amount of training. This group could be someone who just simply follows, a blog or a listserv, to people who go to conferences every year. So you still are going to have variation in this community. But how does it change? And so what we found remarkably was fairly similar patterns. So on the left is more stressed and less sense of innate health and sense of support. on the right is this sense of low stress and rumination and high levels, quite high actually, of innate health and high levels of resilience and support. And you have that sort of middle pattern where there's a buffer. You have these intrinsic senses of your own innate health and resilience, not a lot of sense of support in your world, but also not as much experiencing of stress and rumination. But there were a few differences between the general population and the 3P community, which we found really, really interesting. So the first was, and this gets to your question, Anne, about the numbers. The first is in the general population, when we say people, the sort of most challenged group in the data had really high levels of stress and rumination. We're talking, 1.0 and above the mean. So statistically large differences in their sense of stress and rumination, and really low sense of their own capacity, as well as low sense of external supports in the world. So very, very strong. And we called that struggling. But in the 3P community, that group did not exist. So that level of sort of struggle as a group just did not exist in the 3P data set. The group that was the most stressed or sort of having some of the challenges that they perceived was more akin to the second group in the general population. So it's just quite interesting that that level of struggle, even though the pattern was there, that level was not present in the 3P community. And so you see, sometimes the other thing you found was the amount of innate health in the thriving population was extremely high, like 1.45. So we're saying that's almost 1.5 above the mean, which was it was a really high level. And ironically, their sense of resilience was sort of slightly below the slightly below the general population, but their sense of innate health was just kind of off the charts. So you really see that connection between the 3P community and innate health, which just reinforces, what we were saying with this measure capturing something important. What was really remarkable was the distribution, however. So in the general population, we allowed the data to sort people, so it didn't have to be even across groups. It was really about the profile that every individual was showing and where they fit in the groups. 23% of the people in the English population fell in our thriving group. And we had 87% of the people in the 3P community fall into the thriving group. So the nature of the curve, the nature of the data showed us a really different distribution of who was in what group, and that was pretty remarkable, actually, especially given some of the levels of stress or rumination were not, all that different than the English population. So that was a pretty remarkable finding.
Yeah, one thing I will add here that people often ask me at this point.
Yeah.
Well, how do you know that, that the norm population wasn't just a much more vulnerable group, and, that if people were homeless or living in prison, or that could still be this kind of distribution, this kind of impact. And one of the things we did first was actually test in those communities. So we tested in prison, we tested in addiction center, we tested in unemployed population that struggle with homelessness and multiple diagnoses. So it's not so much that any one thing shows you the whole picture, but it is that as we collect more information, we begin to see this picture emerge, right? And so this is a piece of information that goes along with some of the other things we've seen along the way.
That's really important, right? So the question is always, well, did you just get a funny sample? And we can't totally answer that, but what we can say is innate health really was helpful in these very vulnerable populations where we studied pre-post effects. When you combine that finding with these data, that's powerful. The other thing to remember is we did a population representative sample in the English population. So that was not, it's kind of the average of everything and it was balanced by income and gender and age. And so, so it's actually it's a good benchmark from that standpoint. The other thing we found in the 3P community that we did not find in the English community, and then after this, I'll be excited to show you your data, but we found this really interesting pattern, which I have highlighted. So yellow is the stress, the sense of perceived stress, which is high. So if you notice, it's 1 point above 1.0. So this group feels a lot of stress in their life. They do not have this sense of rumination around their stress, which is quite low. That itself is remarkable because in psychology, and Jean can tell you more, but those two things rarely separate. They almost never separate. If you feel a lot of stress, to some extent, the reason that's so impactful is because you also ruminate about that stress. And here that it was not the case. And then the other thing that was high is innate health. So that is remarkable because that starts to point to this idea that which is fundamental to the three principles teachings around the role of thought, in the experience you're having. So it doesn't prove that, but it's consistent with that kind of, line of thinking. Jean, you want to jump in on anything there?
I mean, if you accurately described that.
So it's a very small group. So I'm just going to qualify that as the research hat on. It's exciting and it was a small group. So, it begs more exploration, but it was definitely exciting to us to see that because that is sort of the theory then starting, the teaching starting to play out in data, which is really not always easy to find. And then we get to come to your data. So now, doing those groups requires a really large sample. So that's one of the things we're really trying to work through is how to figure out we like the groups. We think people understand them in some ways, but unless you have sort of almost 1,000 people, you can't make the groups in any reliable way from a data standpoint. So we can't show you your own groups. But so we're still working on ways to share. But what we found here is simply looking at that same pattern. So stress and rumination, and this is within just the Denmark sample from that larger data set. And what we found is in the general population, as expected, stress, which is the gray bar, and rumination, which is the red bar, are pretty equal and consistent. And in the Danish sample, what we found was stress at really not that different of a level. It's not, it's a fairly equal level. So sort of same level, maybe slightly lower, but not necessarily statistically lower from the general population, the normative population, the English population. Slightly lower experiences of stress, but definitely lower experiences of rumination. Just so within that sample, you all showed that pattern as a group, as a subgroup of the whole data set, which is great to see and actually should feel quite encouraging to you all. And then the other thing we found was same thing, despite you're having equal levels of stress in the Danish sample compared to the rest of the sample, you had higher senses of resilience, higher senses of innate health, higher senses of received support and provided support, and higher senses of well-being. So we all wish to be in the Danish sample of people because you all are doing great. But it was quite exciting to see, again, even when you take the patterns just keep repeating, and then to see it in your own population is really exciting. And I think those might be the only.
Is there one more?
I think there's one more. Oh, yes. And then consistent with that is lower, and these are decently lower levels of depression and anxiety compared to the rest.
Yes, Adrian wanted you to know that you guys are much happier than the rest of the 3P community. So
and I misspoke. Right, the comparison here is actually the rest of the 3P community in our broader sample, not the English normative population. Sorry about that. Although the scores are still standard, so that's actually quite impressive as a group. Yeah. Any questions? We'll just stop here for our comments or questions. We'll take the celebrations as well.
Celebration. We
Thank
feel
you.
all right. Celebration.
Well, and so it continues. We want to just let you know that, the work is continuing from that survey and from those results. And the big thing that we're working on right now is to get about 500 lines of pre-post data, of which Denmark samples are participating again, which we're excited for. So just the information we just presented on, it was one time point. It was just, let's do a survey and let's look at it. And that gave us some great information. But now we really want to look at programming, and it can be unlike the research studies that we listed before, which are very controlled and will do research on each sample, right? So we're going to look at the Spark adolescents as their own thing and write that up. We're going to look at the men in prison as their own thing and write that up. But what we're looking at now is across these different locations and program partners, any sort of training, whether that goes from a 12-month program to a 5-day program, just if we combine it, what can you all collect pre-post data with the infrastructure we're offering you in a reliable way? And we're using that as a pilot to understand how hard it is to collect data in the field, what we need to support you all in doing. We're simultaneously building some really sophisticated technology, which maybe we can come back in a couple months to share with you all. But we're working on building our own platform where you could securely log in as an organization or account, as a coaching practice or as a program partner, securely invite people on your listservs to this platform, and they could take the surveys and you could collect pre and post data and actually get your own reports on your own programs in a way that is secure for you and we wouldn't see individuals' information, but also would feed a global data set, essentially of 3P programming that we could analyze as researchers in an anonymous way. And so we are maybe 3/4, maybe halfway through, 3/4 if we're being ambitious, through the building of this technology, and it's going to be to global data security standards and all other sorts of things, and thinking about how we can roll this out to the field. But this, yeah,
Our EU partners always ask this, but where's the data being housed?
It
And
will
I
not
want
be
you
housed
guys
in the
to
US.
know it will not be housed in the US. Do not worry. Do not
Yeah.
panic.
Yeah.
Housed in the EU. So just put that off your mind right now.
Yeah. And we've built a technology within it so that immediately when it goes to data, it's essentially an anonymous number that gets assigned to people. So we never see names and things like that, but we'll tell you more about that. But we're in the middle of doing that, and it's a result of just seeing how beneficial it can be for collecting data from the field as we did. So your participation in that survey really led to lots of big thinking and continued investment on our part into how we can keep giving you all tools to look at your programming, be able to advocate for yourself locally or even at a regional or country level. And
Yeah.
we're really
And
excited.
one of our visions now is to create what Anita was calling norm scores, so averages across these different populations that we're studying, so we can compare, say, your outcomes as a Three Principles Denmark to the average adult in Denmark, right? So it's one of the things that needs to happen next. And so we'll be talking a little bit about some of those next projects that will help establish this kind of programming in a really credible way, in a scientific way.
Yeah. I think that's it for the slides, so we can move into just discussing or sharing, Jean. But we hope this was useful information. Our hope is even something like this could be taken to somebody, even though it's not Denmark norms, or even if it's not your program, the more we can provide things like this to point to the potential in this kind of programming, and then the more we can give you tools where you could really make sort of laser focused data for yourself or the case you're trying to make, or if you're writing grants, or, you know, if you're approaching and having a conversation. We've found it's amazing how people settle down when they think you're even part of research. And so to some extent, you've all have already kind of become that. So we thank you. And I'll stop sharing so we can just discuss or take any questions. Yeah, but thank you all for listening. Any thoughts or questions? There's nothing to, you know, we can clarify anything.
Naomi?
Yes, well, I just want to say or tell everybody listening that we have been working with you. We are members of the community and the pilot study. And it has been so, I just want to say it has been very, I don't know if it's called pleasurable, but it's been very easy. Been very easy to work with you. And I'd really recommend to join in and not be afraid to contact you because, well, we have just been felt very received by you. So thank you for that. And it's very nice to sit here and see that you have been building something that we didn't know about and just feeling like, oh, wow, it's so amazing to be part of something that's growing on its own. Yeah. So just thank you.
Thank you. We really appreciate that feedback, and we really appreciate you telling your program partners and friends about what we're up to, because the more voices we can engage, of course, the better the research, right? And so that's a really important. So thank you for sharing that. And we really, really want to make this accessible. It's something that's really important to us.
It's so nice to know. And also then when we are, you know, we are based on funding, and it's very, very satisfying to say we have some professional researchers wanting to back this community up. So it really is a safety net to come with and be part of. So it's just a two-way street here. Amazing. Thank you.
Thank you.
I saw Anne and then Helga.
Yeah, I just want to say thank you. I think that it is such an important work that you are doing and very, very inspiring. I'm part of the Danish research group also for 3P, and I think it is very, not nice is not the word, it's much better than nice, but I mean, we have people we can reach out to and pull on your experiences because I think that putting this into form and trying to start to obtain data for something like this is really difficult, and I think that it's really important that both that you show the data and also that we can discuss with you how the setup has been, and because you have probably gone through all the thoughts that we may be looking into starting out on something extra or some new projects in Denmark. And I have a question because it just popped up with regards to the practitioners, the 3P practitioners, and in principle also the people who are participating in the giving the data. Is there some kind of qualification in relation to? I mean, I know for myself it's always going deeper and deeper into this understanding. So if I was to either be a practitioner 1 year ago or participate in something 1 year ago, the answers from me would have been very different than they would be today. So I just wanted to ask your experience with this issue, and also is it something that you are challenged upon? Yeah.
In fact, it's an important part of our survey development was asking about how much exposure. You can't really test somebody's understanding yet, but you can test how long have you been here and how they measure, of course, across these different surveys. And we did find that with more exposure, people had lower levels of anxiety and depression. Anxiety in particular across surveys changes significantly with a three-principle intervention, but also higher levels of innate health. And so we see that trend, let's say, across studies and with exposure. And so it's an important question because, of course, you are different at year 1 than you are at year 10. One of my projects that we're talking about getting off the ground is Anita and I have talked about doing this thing where we interview really experienced practitioners about their experience of innate health, so that we could potentially develop a measure that would be less for like academic publication and more for professional development. And so, it's one of the things that we would like to do, hopefully in partnership with our 3PTC friends. We'll see.
I think exactly that answer. I'll just add, so what we hope with this new technology is we would have the ability to measure, if someone wanted to measure their people they're working with now, and then after 12 weeks of programming, and then 2 years later, that they could, we haven't had the ability to do that yet. So we haven't looked at those long terms, but, the hope is our measure would evolve. Or we have a measure, or we would expand our measure through these interviews, because it's always iterative. So we have a measure that's working well now, but maybe we want to expand it or have a different kind of measure. And the only other thing I want to say, which I don't know if you're asking, but sometimes it's like the question under the question, is it's really important to remember that we are measuring, and I think we're touching something about understanding that is really important, because it can show in data, in a data story, just like we tell other stories, in a data story, but it is still reductive. It's like any research is reductive. So we're not pretending that innate health as a measure is measuring all dimensions of understanding or the unfolding that you might experience, or how to train it. They're two separate things, but it's one version of a story that can be very compelling to opening more doors. So it's not, I just always want to say that we never think like this is the entirety of what it means to understand or to have absorbed or to have innate health. It's not the same, but it's an indicator that is showing some power in telling its own kind of story.
Yeah, and add to that, you've probably noticed we don't use the word spiritual, and it's fundamentally because we can't test that. So science is only designed around things you can test. And so that's why we use the bridge, let's say, of innate health.
Yeah. Helga, I saw your hand up. You've been patient.
Well, I just wanted to give you some feedback around the question, so a little about what you were saying now. I'm from the Norwegian community, so I have translated all the questions.
Yeah.
And yeah, just to tell you, but also the ones who hears this, that I think the questions are really, really good, because there is no problem answering it if you haven't been into the principles at all. But at the same time, when you have been into the principle, you can like kind of recognize something that it is a bit different. So it's just to say the ones who are thinking about wanting to participate with you, I really hope they are doing it. As I've heard from several practitioners who are working with it, it's really hard to come into schools, to healthcare, to businesses, and they are like saying, but do you have some research? And until now, we are saying like, oh, we don't. You just have to believe us. It's great. Yeah. So just thank you very much. Yeah.
Well, and we really want to thank you for that. I love hearing that. It's very exciting to hear that.
Yeah.
And I want to say, it's really our vision, and it really depends on funding, right? I mean, let's be real. Research is very expensive. So the more funding people can help us find, or, to promote these goals and these visions and make them reality, one of the things we would like to do next is develop the adolescent measure, right? Is develop the business measure. So each survey, each questionnaire has to go through a similar process of testing and making sure we're asking the right kinds of questions alongside innate health, and then being able to demonstrate, well, actually, innate health is really important in business settings, or, well, actually, innate health is really important in adolescent settings, right? If we don't design ways to ask those questions, we can't say, yeah, your business could really benefit from a program like this. And so that's research that's in our vision, on our docket, we've described it and are working with partners on, but also needs funding.
But I think what you already have is also something you can take with you into schools and health and everything. Yeah.
Yeah, definitely. Good start.
I'm not sure I see everyone. So I see Nomi's hand up, but if I'm skipping someone, Jean, do you see? Just say so. But otherwise, Nomi, I see your hand up.
Yeah. Well, it's just a very low practical question, because we have the link to the survey. What if some of our participants use the link and send it to a friend saying, try this. This is fun. Try to see, or whatever. How does that land with you? What do you do with that? Is that...
And it really doesn't, because the way the survey is designed, it's asking questions that help us decide. For this particular one time point, we are just looking at an array of understanding, right? An array of exposure. Some people had never heard of the principles because they were just really introduced at the conference and they got this link. So we have very low exposure, and then you have like very high exposure. And so because we ask those kinds of questions, we know that's not an issue when we're doing the research. So we can assess for that. The other thing I would just say is that once we have the tech, I mean, it's really program partners who are sending the invitation to their clients. And so those clients are filling out a survey for the program partner. It is unusual for someone to share such a survey.
I was just wondering if there is some black or gray area of something that you'd very much like to not have.
Not that I would say. Anita, what do you think?
Not in a one-time point. I think if it's a pre-post, it would just work against the program partner if the person being sent the link doesn't participate in the programming. So if it's about like, how does my 12-week coaching work? And the pre-survey, if the pre-survey goes out to a whole bunch of people, and then who aren't going to take the program, and then they get the post survey, it could just make the understanding of the impact of the program messier. But in what we've previously done, which is just one time point, the more people, the better, honestly, because the more in science, the more variation, the better. We may not have them, and because they'll take the survey, we would get them as a line, of information. We would have their basic demographics. We wouldn't have their name or identifiers, but we would know that they were there. We may not know how they got there, but it would be important as someone who wants to say, like, I want to see if my coaching works, that which is a good thing. We can kind of make sure that's part of the instructions, but you wouldn't want then that to be forwarded on, because it could work against you as a program.
But then you can see if there's a follow-up questionnaire, then you can match those two and take the percentage of that.
That's right.
And then see what
comes.
Okay. Thank you.
Yeah. Anne-Marie?
Yeah, hi.
Hi.
Thank you so much, first of all, for the amazing job you're doing. I'm studying medicine, so I think it's amazing also to get some data on it, just because we live in a world of form. So thank you so much, first of all. And then I wanted to ask, the graph that you showed with the different groups, is that published yet, or is it part of a paper that has to be peer reviewed, et cetera, et cetera?
So the analyses we're doing for publication is going to be a little more sophisticated than the groups. They're going to do a mediation and moderation. Those are in progress. They would complement the groups, but the groups we're making to sort of make it easier for people to understand essentially the regression and the correlation patterns. The papers will have the true kind of models, with the numbers in it. So just these presentations, which I think could be, I know they're not peer reviewed, but they could be cited as a presentation. Yeah, yeah,
Okay, that makes sense.
yeah.
Yeah, and then I also was wondering the stress in the new group that you found within the 3P community.
Yes.
Is that like defined as like a classical external stressor, or is it more experienced stress? Because I was wondering what the difference was between stress and rumination in your research, because at least in my head when understanding the principle, I was like same. But I
Yeah.
guess that's more the experienced external stresses or my
It's
Yeah.
a great question, and Jean, you can probably answer,
Yeah.
but
I mean, basically in psychology, stress is an external event and rumination is what you do with your thinking. So you can think about it like that. And of course it's all psychology is self-evaluation. So you're comparing apples to apples that way. That people are self-evaluating where I'm at. And so yeah.
But there's the rumination scale is a formal, like not from us, from somewhere out there, that's a rumination scale. And the stress it is about external events, but perceived, we call it, I wasn't using it consistently, but perceived stress. We have thought about, there are those things where it's not about their perception, but just about the number of events, like, did you have a baby? Did you lose your job? Did you whatever? And we don't have that, but they're embedded. We haven't pulled those out. We've thought about this as something to do, is kind of try to equate people on not their perceptions, but on their experience of certain life events, and then see how the results go, which is something we'll probably do at some point. But
Yeah, we can talk about it.
yeah.
Thank you so much. It makes total sense. Thank you.
Yeah. Anyone else?
I'm aware of the time, so I just want to make sure everybody knows, feel free to reach out to us. You can find us at innatehealthresearch.org, or you can follow us on LinkedIn where
Please do follow us.
yeah, please do, and share our LinkedIn. It's just a way for us to be able to say, hey, this is what we're working on this week. This is what we're visioning. This is what's happening, and keep you informed. So please do follow us on LinkedIn. And if you want to, you can also follow me on Substack. Sometimes I put a little bit of something out there. And I just actually posted about what's the difference between program engagement surveys and research, empirical scientific surveys. And I think it's actually very relevant to program partners. So feel free to take a read. And, thanks for coming, you guys. So pleasure.
Thank you so much. We're the one who says thank you so much for coming and sharing the results. And I just really, I guess, want to end with just stressing the significance of what you found. Like, imagine that people who realize and have insights about their innate health don't ever fall into the worst part of struggling. Like, how amazing is that, that we're actually realizing something and sharing something that will help people not fall into the worst category of struggling. And then also, we have this new category of people who can be exposed to stressors and not ruminate about it. I think it's pretty amazing findings that you have. And last but not least, like 87% falls into the category of thriving as compared to how little in the, like, I just think those three are just amazing findings, and they deserve to be stressed. So thank you so much for presenting it here.
Thank you.
Thank you.
Thank you. Thank you for having us. It's fun to share.
Yeah.